Alright, it's Anitra. It's my 4th video on the cancer journey that I'm on. I was diagnosed with triple positive invasive ductal carcinoma in my left breast. I found out, I made my last update a week ago, and then on Monday I went to go see the doctor in Carson City, and then after that on Friday, which was yesterday, I went to see the oncologist. So when I went on Monday, I was really excited to get an ultrasound because he had said that I would get one after 3 treatments, and then I received 6 treatments. So I had pretty high expectations. He went and got the ultrasound machine, and it was a bit strange, actually. He didn't want to say the number. It was like, okay, well, how big is it? And he basically said, well, looks like it's about 1.5 centimeters smaller than it was before. And I was like, okay, well, what was the number from before? And he was like, he just basically wouldn't say. It was very bizarre. I really lost a lot of respect for him, actually, at that time. And then he felt around on my breast and said, wow, it feels a lot looser and softer. And I said, yeah, I know it does. So he basically was just commenting on what he could observe and what he could feel, and he wasn't using the ultrasound to say, okay, it was 3 centimeters and now it's 2 centimeters. I mean, I know that something's changed, but like I think I said last time, the surgeon that I had said a lot of things could be at play here. Your breast could be, it could have just relaxed and the inflammation is gone, and things could be, it could be that your subjective experience isn't good enough. So I wanted something a little bit more, I wanted harder evidence from the ultrasound, but I didn't get that. And so he basically he wanted to schedule me for another dose of Herceptin, and I said, no, I can't do that. So he said, I think you should get another surgical consult with somebody. That's what he wanted me to do. And I made an appointment with the oncologist over here at the hospital, because I talked with my partner on the way home, and I just realized that I needed to do something more. Essentially, it does seem as though there has been some change and there is a reduction, but not much. Not enough for 6 treatments of Herceptin, getting IPT, the low dose chemo, but it's not really chemo, actually. It's an immunotherapy. So, let's see. So I was a little disheartened after meeting with him. It does feel like all the visits I had, the 6 different visits I had, I was getting the IPT. I was also getting an antibiotic bag afterward. IV drip is what I mean by bag. And then he was ozonating my blood, and I was getting an ozone colonic, and I was doing an ozone sauna. So those are all really good things for health, and I still feel healthier than I've ever been, really. But that's not my goal. I mean, that's part of the goal. There are 2 things. One is shrinking the tumor, and one is being healthy enough so that my immune system can handle fighting off what it needs to fight off. So it's like two different routes that I need to go. So it was great that my health has been strong, but for the amount of time and the amount of money that I spent, it wasn't what I needed to hear. So as we talked about it, me and my partner, on the drive back, I made an appointment with the oncologist and said, okay, I'm ready to get Herceptin. And the oncologist thinks that Herceptin is basically a game changer because the side effects are so low. The research I've done has shown side effects. There could be some joint pain, there could be some joint aches. Some people are on it for 10 years or 5 years, but the traditional, or the standard dose, as far as I've understood it, is for 1 year. I don't know how long I'll be on it for, but we'll have to see I'm about to get another ultrasound, and then we're going to do, with an actual measurement this time through the hospital, and then we'll do some treatments, which they're 1 treatment every 3 weeks, so maybe after 6 or 9 weeks we'll ultrasound it again and see if there's any improvement. But anyway, back to the side effects. I have heard the worst side effects I've heard have been some sort of like joint and bone aches and pains, and then there's just general sort of fatigue, not feeling quite up to par, needing to rest, a little bit of nausea. The oncologist said he'd never seen this before. He's been giving the Herceptin for a lot of years, but somebody recently started getting shaky, like the shakes while she was having the Herceptin treatment. So he said, I've never seen that before, and of course anything can happen. So anyway, they will monitor my heart. I was looking at, I think the breast MRI, or it might have been the PET CT scan, I'm not sure which one it was, but it showed that there was a small pericardial, I think was the word, but basically in my heart, some fluid effusion. It said something cardial effusion, which meant that there's some area in my heart that there's a little bit of liquid, I guess. So they're going to monitor that, and actually when they give the Herceptin, I think I'll be in there for an hour. They'll be monitoring my heart the whole time, and they said anytime there have been any kind of heart issues, the heart recovers right away. Like as soon as the Herceptin's not being given, it recovers immediately, and then it can be given again. So sometimes women have had to take breaks. I feel fortunate that they're going to give the Herceptin by itself, because a lot of times they give it with something called Taxol, and I think they also can give it with other things as well. And it used to be that insurance would only cover it if it was that exact method of delivery or that combination of drugs being delivered. So they will just do the Herceptin, and I'm crossing my fingers and saying my prayers that the Herceptin alone is going to be good enough. So before, I did ask the doctor in Carson City about using black salve and some other things, and he said, no way, don't do that. Black salve is good for skin problems, like if you had some sort of lesion on your skin or something small on your skin, because basically he said based on the size of the tumor that you have, you would create this gaping hole. You'd have this gaping hole, and you'd have this incredible mess to deal with, and it's absolutely awful. So I ruled that out. That was good enough for me. I think I just got really disheartened after spending that much time and money going there, and yes, it did change things, but it didn't do what I needed it to do. So I knew that I always had the hospital in my back pocket. I knew that I was trying something by trying this alternative route. It may or may not work. It may not do what I needed it to do, and it did help, but it didn't do the full job. So when I left the oncologist appointment yesterday, I felt really good. I felt like I was in good hands. If I were getting chemo and radiation, I think I'd be a lot more afraid. I'd be a lot more worried about some of the intense side effects that people do get with those things, and I don't think I have that at all to worry about. Herceptin is really billed as this miracle drug for women who have HER2 positive breast cancer, or maybe HER2 positive other types of cancer as well, because they just haven't come across anything with so little side effects. There's no hair loss. It's not chemo, it's an immunotherapy. So if I understood it correctly, he said that the Herceptin goes onto the receptor, and it labels, it marks that cell, or it marks the area so that the body can then go in with the white blood cells and eradicate it, take care of it in the way that a normal healthy immune system would. So the Herceptin just kind of guides the immune system to take care of it on its own. It's pretty cool. So I'm excited about that. So on Monday I meet with the nurse again just to make sure I feel comfortable, and she'll answer any questions that I might come up with. But I'm just going to ask her basically how it's going to go, what it's going to be like when I get in there, how long I'll be there, and what I should expect. And we have had this meeting already, but when we had it a month or so ago, I was basically listening with half-closed ears in a way, because I knew that I wasn't going to do it. So now I am. And I am looking forward to just getting the lumpectomy. The doctor in Carson City said this is extremely treatable. You have it in one area. It hasn't spread. If it had spread, we'd be doing something totally different. Surgery would not be needed. And you should take advantage of the fact that it's localized right now. I do feel it in my lymph node, and the breast MRI did show that there is an at least one enlarged lymph node. So when the time comes for the surgery, they probably will remove at least one. That's part of the process that they do. There's something else I was going to say. The lymph node, the surgery, getting the treatment every 3 weeks. Darn. It felt important, but I can't remember it. Maybe I'll pause it for a sec. I know what it was. I got the brain MRI, a breast MRI, and a PET CT scan. And over the last couple days, actually it happened before, but it started happening again, but just a little bit different. The last couple days I was getting these like really intense shooting pains in the back of my head. And I mean shooting pains, like felt like lightning was going into my head, like this electric kind of thing that would take me off guard. Like it would come in and I'd be like, ah, like I got electrocuted or something. And it was kind of like happening here and also in my ear. It was just so bizarre. So when I met with the oncologist, whose name is Dr. Campbell, he's fantastic. I really like him. I mean, I've been talking with him all along, and he just, I'm not sure what it is about him. He's very open, and he's very like in your face. He's very honest, and he's very available, like his face and everything he has to offer. So I have a very good feeling about him. But he came over and he started just feeling around on my head, and he said the scalp is a place that is another location that breast cancer can metastasize to. And I was like, oh wow, I hadn't read that. I've never heard that at all. Skin, and basically the brain MRI, he said that checked your brain is fine, but it didn't check your skull, it didn't check your skin, it didn't check back here. So he felt around. He asked me if I had felt any tumors, and I said no. I haven't even checked for tumors. I mean, so he was feeling around like this, and he didn't feel anything, which was good. But you know, one of the things they say is that when you get a life-threatening diagnosis like this, suddenly, you know, you stub your toe or you sneeze and you think that it's related to the issue that you're dealing with. So I'm trying not to compound anything by thinking everything has to be associated with cancer, but when something odd happens and it's like pretty painful, of course I would think that could be the case. So I'm feeling okay about that it hasn't spread to my head, and I guess it's just simple enough for me to just be able to feel around and feel anything. He said, we asked if I should get some other kind of scan, and he said if there's something there, I'd feel it with my hands, and if there's not, it's going to be too small to pick up on the scan. So there's that. What else? I've also really lightened up my supplement schedule to just be the things that are good for health, like vitamin C and CoQ10, and a couple things that were specific for the cancer, and the Greek test that I did, like Herceptin, and I can't remember what else is on there. And then I'm taking fish oil again, because actually naturally I've just been not wanting to eat as much meat. A lot of people do a raw vegan diet, and that hasn't really felt appropriate to me, but it hasn't felt like it'd be the right thing for me to do. But I have actually just my own cravings for meat have really subsided a lot. But when I eat meat, I do always eat organic, local, costs 3-4 times as much money, but of course it's worth it to eat that way. So yeah, I guess that's my update for now. What do I have coming up? I have the meeting with the nurse on Monday, and then she'll schedule me for the first treatment of Herceptin. It'll be a full dose, which I don't even know. I think I looked it up actually. I think it's somewhere between 400 and 500 milligrams, and before I was getting 50 milligrams, so I was barely getting anything. And I was feeling kind of flu-ish before, so I'm assuming I'll feel kind of flu-like again, but if it works, I'm grateful.